the city, but then we also look at, like, you know, other longer term challenges, and looking at aging population is one big issue. That's, you know, even though we're one of the youngest populations, Ireland, one of the youngest populations in the world, it's actually hitting us now. And look at some of the figures in terms of, you know, I think the number of people over 80 in the next 30 years is going to quadruple. But also the strains that puts on our housing, puts on our health service. And Dublin City Council is a landlord to 25,000 social housing units, and we have sheltered housing. So it was really, when obviously we worked together before in the Smart City, but when we heard that you were here in the HSE looking to drive a transformation program, we were delighted to meet up and explore how could we, you know, work in this open innovation, you know, mechanism, and bring, I suppose, the city as a test bed, and look at how we can leverage some of these new technologies to solve some of these big problems in the city, including aging population.
Brilliant, thanks Jamie. On to Jamie's right, as Ved saying, I've had the privilege of you know, knowing, you know, Ved for about a year. He's written an absolutely fabulous book, probably the most readable book that I've ever read on the potential digital technology, and we'll have Ved back to actually give a keynote just focused on his book. But, you know, Ved, you got excited about this project when we started to discuss it, and for people that don't know, Tata is probably the third biggest IT company in the world, you know, about 350, 380,000 employees. So why is Tata coming to Dublin and working with the HSE and Dublin City Council to actually undertake this project?
Thanks, Martin. First of all, really honoured to be here. The last time we spoke was about 3 months back, so now we've crossed 400,000 people. It grows. I think for us, we're a part of the Tata Group, which is one of the older industrial groups out of India. It's a 150-year-old group, and it's a group that takes its role as a nation builder quite seriously. The group truly believes that companies exist not just to serve shareholders, but to serve the communities we work in. So any issues that are relevant to the communities that we work in are relevant to us. And personally, I think that, you know, with no offense to anybody, I think some of the best brains after they are too busy selling, you know, finding better ways of selling more advertising. And I think that's a shame in terms of the technology that we've got at our disposal. So I love the fact that we can actually use technology to make a real difference to real problems. And for our you know, what we're doing here, we're also in a really interesting space in the evolution of technology, because for the first time, we've got technology that learns to work with humans rather than the other way around. You know, we've got technology that you don't have to spend 6 days in a training course to be able to use. And so to be able to wrap this technology around the way vulnerable people live and to help change their lives, of course, really attractive to us. We've built something out of a project that's been about 5 years running in Singapore, and we're trying to use the same platform to bear for the problem we've got here, which is helping elderly people live longer, age with confidence in their own homes. And that's what we're super excited about participating in. And I just want to say that while there are lots of really interesting opportunities, you saw Stevie the robot, and there are many technologies we can start with. We have a very small and simple starting point that I'm sure Lorraine will touch upon. But it's really interesting to be in a place where you can see that roadmap ahead of us. This has not been done anywhere else in the world before, by and large, at scale. So there are many questions that we just don't know as yet. I think Douglas Adams said, you know, computers are useless because they only give you answers. We are in that stage where we have to learn to ask the right questions, and then over the next few months, I think we can try and answer them. And I think there's a really fabulous journey ahead of us.
Great, thanks very much. Lorraine needs no introduction from the HSE, but Lorraine attended the second or third meeting of the HANDS group, and within 2 minutes of, you know, her finishing, I had a text saying, you know, I want to be on this project. So, and you know, Lorraine just has this knack and savvy of being able to connect people, and within a day she was talking to the public health nurse and discussing, okay, how could this change your role? How could it give better care, deliver better care? But maybe Lorraine, you could share with us from a HSE perspective why this project is so interesting at this point.
Yeah. Basically, before I came to work in Dr. Stevens, I worked in the primary care for 7 years in Wexford, so I would have been a primary care supplies officer. So I would have dealt quite a bit with the public health nurses, the OTs and the physios. So I was very familiar with the area of kind of patient care and patient care in the home, and kind of, you know, keeping an eye on them. And when I seen this project, I actually studied for somebody else and seen the project, and I said, I just have to be on it because it's basically, it's so unobtrusive, like it's a little sensor, like that's the size of what we would call them, like old-fashioned matchboxes. And there's like about 4 or 5 sensors that goes within the home, and we're able to monitor if someone hasn't got out of bed, if someone hasn't left the home, if the door is open in someone's house at 3 or 4 in the morning, and like that's so unusual, you know, we'd be able to see that there's something really different happening. We can even like track like the gait of people and see over time if they're deteriorating. But one of the real issues that older people would have would be like, you know, isolation. And we'd be able to tell not only like who's coming in, but we're able to tell if they haven't gone out. And that's more important, because isolation is nearly as bad as smoking. You know, it's there's statistics there that say it's so bad that, like, you know, they deteriorate because they don't have social interaction. So it's really, really important. So if someone hasn't been leaving the house, we'll be able to know, and we'll be able to say, okay, that's a highlight for the public health nurse that needs to go in there now. The other thing about the sensors I find was brilliant. Normally what happens in the home would be that they would have like a big string coming out of the ceiling, and it's kind of, it's so, the aesthetics of it is so unpleasing. Now what they do is they tie it up. So you have these strings all tied up, like, so if the person falls, they're not going to be able to reach it, like, you know what I mean? So this is how, like, the sensors, if someone falls, we can see it, like, you know. So it's just, and it can progress from there. There's more that can follow on from there, but that's basically what we're at the minute. And I just thought that, you know, it will lighten the load of a public health nurse as well. I know a lot of the times the public health nurse would have spent time chasing up clients to see where they are. They're not in the home, or maybe they are in the home and they don't know, and then they're chasing to see who do we go to next. Whereas we'd have like the contact details for the patient's family, you know, a network of people that we'd be able to contact. So it's really, there's a lot more to go into it, but at the moment, like, it's a good starting point. And I think with my experience with public health nurses, I think, and the one we were talking to, who couldn't be here today, so I said I'd represent that area. But I just think that, like, it's going to be something really, really beneficial for older people.
Great, thank you, Lorraine. We have a couple of other people here. Actually, we're on the Master in Healthcare Innovation Programme here. Leslie's come up from Galway. We have Leanne, based in Palmerston, Ian Darby. But on the last day of the Master in Healthcare Innovation Programme, the last 2 days, there was kind of a digital sprint, and actually we had a competition, and the idea that came out sort of as a winner was something called Staunch Aware. And we're really interesting technology, and the Think Biosolutions technology that I demonstrated earlier, that actually has GPS built in. It has an accelerometer for falls detection, but also can be used for wandering. So if somebody has dementia or Alzheimer's, you know, if they wander out of the local, they can immediately be detected. So, you know, I think, you know, the whole idea of ambient sensing and wearables, the technology is ready now, and we really want to test this in the environment. And when we test something, we actually have to figure out, we have to have a research plan. We have to carefully design the experiments, and that's where Mary Galvin comes in. Mary is a very passionate Cork woman who's recently appointed to Maynooth University, and has been one of the driving forces in terms of moving this project forward. So Mary, you might talk to us a little bit about the research plan, what we'll be looking at, and how we'll be measure success.
Yeah, absolutely. Thank you, Mark. It's Waterford. I was in Cork for a while, unfortunately. I suppose, yeah, I mean, that's the exciting thing. I think the technology is definitely ready, which is fantastic. I know the exciting thing for me is, are the people ready? So what's beautiful about this project is that we're starting very much anchored in the home. So when I say what is home, each one of us is going to think a different thing. It's security, it's identity, whatever that might be. So if that's our starting point, we're not looking for technology to replace that with anything. We're looking to technology to support that and foster it and make a better future for someone. I just remember a lady that I was working with at one stage, and she was living with dementia, and I met her. She lived alone at the very start of her diagnosis, and her home was her haven. She was so creative, she had so many different pieces around. As her dementia progressed, her home became too much for her, and her objects just turned into piles around the house. And I was there the day she left for hospital, which she ended up going to long-term care. And she asked me, just find me 2 clean nighties on my face, so I look nice in there. And there was that moment that I found like her little rouge, lipstick and 2 clean nighties, and she stood there with her plastic bag to leave her home. And I was like, my God, where is the space for design there? Because in that moment, all of her identity, all of what could move with her into that long-term care. Now we're at the stage of maybe what data can move with her, or what would have helped her manage her home. We've seen Stevie earlier on. If Stevie was in her home, what could he have done? So from a research point of view, going back to your original question, Martin, before I went off, is to base it in that, it's first of all explore, remove the discourse of deficits that exist around the ageing population, and to look for the difference between them. Everyone is different. Let that be our basis, and then go from there to see what our response will be through technology, because we can get the technology to do anything now, but we just have to make sure that it's slotting into that home environment.
Great, well, thanks very much, Mary. And lastly, Common Workers representing DSP, and it's just amazing how small Dublin is. Probably 3 or 4 months ago I was walking up to Ibeck in Bagot Street, and I happened to see one of Colin's colleagues, Peter O'Shea. He's got a strategy for DSP, and we literally had kind of a 2-minute conversation about this project and DSP's interests, and all of a sudden Colin showed up at one of our meetings in the booth, and DSP came on, very quickly came on board, and DSP is one of the most trusted brands, particularly with older people, and they're, being a really strong addition to the partnership. I was talking to Peter O'Shea actually the other night in the British Embassy, and the first thing he said to remember me actually, I remember that DSP were also philanthropic, we want to do good for society, but we want to make money out of this as well. So maybe Colin, you could tell us the perspective from DSP and why you're involved in this project.
Yeah, thanks Martin, and thanks very much for the invitation to the event here today, which is really, really great. I found the presentations really, really inspiring actually in terms of the challenges that the HSE have, and also to be invited to the HANDS project. So we're very much looking forward to participating on the HANDS project. And I suppose the question is, what has ESB got to do with all of this area? And I asked myself that as well. But in my own role is looking at emerging technologies, and of course the energy sector has gone through a massive transformation, no different to your own sector, and it's transforming towards a low carbon future, and that brings with it many challenges in terms of generation, in terms of the network, in terms of keeping the lights on, but also in terms of customers. And we've done a lot of work in terms of looking at customers and products and services and what we call the prosumer, or the proactive customer. And normally in an emerging technology area, we develop what's called a roadmap. And we did a roadmap for the prosumer, and that threw up around 15 or 16 different ideas. And one of the ideas we had was to build on work that we've done with smarter home technology. And I don't know, some of you may be familiar with that smarter home from Electric Ireland, which is based around energy efficiency in the home and using electricity more wisely in the home, which is obviously part of our core strategy. But one of the other ideas we had was around using the trusted brand that we have to kind of use that brand to see could we offer services to older customers. And we started off thinking in terms of older customers, but as we did more work on it and more research and talking to the stakeholders involved and talking to vulnerable people themselves and their families, we came up with this concept of peace of mind, and that's when we bumped into Martin and stumbled across the HANDS project. And it's something that we're looking at the moment in terms of our own pilot, in terms of could Electric Ireland potentially make an offering in this sector to vulnerable customers. But we're really looking forward to the collaboration with our partners on the HANDS project, because we have an awful lot to learn, and we think we have some learnings to contribute as well. So it's very much in the spirit of open collaboration and open innovation, which is very much part of our strategy, because I think all of the organisations here, including yourselves, face huge challenges in terms of the digital transformation that the HSE is going through. But it's really through open collaboration and open innovation that those challenges get addressed. So we're very much looking forward to the project.
Great, thanks very much. I think you've got sort of a sense of what we're trying to do with hands, which is healthy aging for a new digital society. I'd love to throw it open to the floor, but I think if we keep going on the agenda, does anybody have a really urgent question that they'd like to ask? Okay, if not, please thank the panelists and thank you for being with us. So we're kind of into the last hour of the program. I know it is hot in here, but maybe open the door and see if we can get a little bit more. Erin, Minister Daly talked about mental health and also the integrated care program for older persons. So in the next session, Dee and Owen are going to talk to us first about the ICPLP program, and then we'll actually have some slides around the Living Lab that's happening in Cork by Owen, who is the CEO of Carefolk. So maybe Dee, if you could come to the podium.
Thanks, Mark. Yeah, so I just to give you a bit of background. I started working with the Integrated Care Programme for older people about 4 years ago in a very different landscape. And there were pockets of integration happening all around the country, but like nothing was joined up, and there was no policy on integration. And there was no sort of vision of a kind of end-to-end pathway. We had a model of care for acute hospital. There was no end-to-end pathway across the whole keeping well at home, right through community and into acute hospital setting. So now we're in a very different place. We're working very closely with Launchicare in implementing their strategy. We've spoken a lot today about shift left, and this is what this is all about. Treating people at the lowest level of complexity as close to home as possible. And in order to do that, there's kind of 3 main areas we were focusing on: healthy living, enhanced community care, and hospital improvements. And none of this, the joining up of all of these sectors, none of this can happen obviously without ICT. It's critically dependent on that. So we now have an older person service model. And this articulates this Launchicare vision and the shift left policy. And the main thing is to keep people living well and healthily at home, where they can manage their own care, and technology is key in that, where they can connect with and link in with community services that are already there, with local authority services, with voluntary organisations. And again, ICT is critical in that, so we will have digital service directories maybe. The next kind of key part of the service model is that older people will be treated at primary care level in a community health network. Now this is the new structure for delivering care in Ireland. There's 96 networks throughout the whole of Ireland, and each network is going to cater for a population of about 50,000 people. So it's a population-based model where the population is going to be proactively managed, where there's going to be case finding for those people who are most vulnerable within the population. And again, we need digital technology to manage that, to develop registers of these people and to do electronic screening of people. So this is the primary care model, and all of the primary care GP and health and care professionals will be working together to manage the care of older people in the community in this way. So the next piece of the jigsaw is the ambulatory care hubs. So this is about specialist care in the community, which otherwise would have happened in hospitals. So this is where we have the main features of this are a multidisciplinary team of specialists, geriatrician, health and social care professionals, advanced nurse practitioners, nursing staff, who will work together to manage those patients that have the most complex care needs that can't be managed in the primary care setting. So there's a comprehensive geriatric assessment carried out by multidisciplinary teams, and there are specialist pathways in place for, particularly we're looking at frailty, falls and dementia to start with, so that the older person is managed through these specialist pathways, whether it's in a rehab setting, in working with the nursing homes, or actually visiting the people in their own homes. Then the final place that we want to see our older people going in the shift left policy is hospital. But once they are in hospital, the ambulatory care hub and primary care community health network will work to get that person, to prevent them going into hospital in the first place, and to manage the discharge of them in a very active and timely way, so that basically lengths of stay are reduced, admissions are reduced, and bed days are reduced. So we're actually implementing this in 15 sites across the country. We started this implementation 3 years ago in advance of any policy, and we've published our lessons learned to date, and we've got data on how this has helped with lengths of stay and with admission avoidance. And that can all be found on our website. And these are the 15 locations around the country where we've got integrated care teams working. I think there might only be 13 there, but there are more teams coming on board all the time. And there's going to be new funding over the next 2 years for enhanced community care that will see this scale nationally. We developed an evidence-based 10-step framework to help the teams have a framework in which to implement integrated care. And the fundamental kind of tenets of the framework are establishing a governance structure across the community and the hospital. And that's absolutely key to the whole thing, and having a population focus on your local population that you're dealing with. So, but underpinning the whole framework is ICT and monitoring and evaluating what we do as we go along. If we don't have technology, there's only so much we can do to get all of these sectors to work together. This is an example of a detailed pathway that it's a vision for the development of older persons care in Galway. Galway University Hospital have worked with the local community, CHO2 there, and they developed a pathway through primary care, an ambulatory care hub, which is a hub and spoke model, and again into the acute hospital. And this is an example of the measurement data that we're collecting again across primary care, ambulatory care and acute hospital. At the moment this is all being collected on spreadsheets, but we're looking at through a case management platform that Owen will be talking to you later on, to collecting this digitally and sharing this information across all sectors. This is a dashboard that we've developed also with, for managing that data. And so when we started looking at integrated care, we looked at what the touch points were for ICT, where we need ICT across the whole journey. So the red picture there is of a case manager, where the case manager is interacting with the patient in the GP setting, in a day hospital setting, in a community hospital, an emergency department, as an inpatient, and also maybe with a palliative care team in primary care, maybe organising transport. So all of these are the touch points for ICT along the whole patient journey that need to be managed. We know that ultimately there is an electronic health record coming for communities, as there is for hospitals, but in advance of this we've been working with the Health Innovation Hub to do something else, to develop a platform for managing care across all of these sectors. And so the first thing we did was we carried out workshops with 2 of our community and hospital teams. That was way back in 2016, where they identified what the priorities were. First of all, they didn't even have hardware, laptops, smartphones, which we've now connected them with. They were looking at remotely connecting into the hospital systems, where a lot of the information about patients is already stored. And so we've been actively working with them on that. They were looking at getting HealthLink, which currently is a communication tool primarily between GPs and hospitals. They were looking at getting that in the community, where GPs could refer into the integrated care team in the community using an e-referral. And we've been working with HealthLink on that, so we're advancing that as a project also. And the kind of last thing, well, the most important thing